Right now, though, Monty, a new survey from nonprofit health research group KFF finds that more people are skipping or delaying needed medical care because of problems with their insurance. We've heard a lot about this. I've heard from a lot of people in North Texas about this covering in the news. It's those skyrocketing prices, and it seems like your insurance is covering a little bit less, but you're paying a lot more.
Yep.
And we're not the only ones. This is a trend happening all across the country. Eric Calciano is a lead benefits advisor for New City Insurance, and he joins us this morning to talk about this. Eric, we appreciate you jumping on here on a holiday week. Let's start by laying out the trends that you're seeing. What's the concern when it comes to health insurance and really just the everyday American?
Yeah, so essentially what we're seeing is that many Americans are underinsured, and when these people have insurance, but their insurance costs are high, and their copays and deductibles and out-of-pocket maximums are higher than what they can afford, they are oftentimes delaying care. So we saw that in 2022, we reached an all-time low uninsured rate in this country at 8%. But we also saw that 23% of working age adults are underinsured. So while they did have coverage, their coverage did not deliver affordable access to health care. So that, coupled with the fact that 63% of Americans don't have enough savings to cover a $500 medical emergency, we're running into a situation where people are putting off care that they need because they're having trouble affording it.
Eric, about 25 years ago, I remember paying maybe $50 or $60 a month, it seemed like, for insurance, and it covered almost everything. Now I'm paying 5 to 7 times that amount, and it's covering almost nothing. Why is that?
Yeah. You hit the nail on the head there. I mean, what we've seen over the last 10 years is the health insurers have drastically increased deductibles and out-of-pocket costs, remember, it's on their plan, and at the same time, they're charging the highest premiums that they've ever charged. So, and at the same time, these insurers are reporting record profits. So they're getting the most that they've ever gotten, while at the same time providing the least amount of coverage for the highest cost for the consumers on the plans. So that's really where this all stems from. And while really this problem stems a lot from our healthcare system and the insurers in the way that they've been increasing costs over the last 10 years, I think that the most effective solutions are going to come from employer-sponsored health plans, because half of Americans get their coverage through their employers, and employers are able to customize their plan in such a way that they remove much of this huge profit taking from the health insurers to be able to offer better coverage at a lower price for their employees. That said, I also believe that there's things that everybody can do to improve the way that they access their health care and get the most out of their health insurance.
Yeah, and then just the last thing I wanted to ask you is, as far as those trends, and you kind of just touched on it, do you expect those to just continue as far as the increase, and then we've got to figure out how to deal with it, or will there be a point where they start to fall again?
I believe that the trends are going to continue to go up, at least in the nearer future. When we're looking at trend increases by the carriers, for this upcoming open enrollment for January of 2024, the early indications are already higher than average. So while we maybe are typically seeing like a 9% or less trend, we're now seeing closer to like a 13% trend on increases with different carriers. So I expect that to continue to go that direction. I think that there is a point where people are going to say, it doesn't provide enough coverage, and we're not getting the access to care that we need. When exactly that happens, I think is going to be a little bit further down the road.
Eric, everybody knew it. We just appreciate you laying it out there for us. Thanks so much for the information.
Yes, you're very welcome. Thank you for having me.
Eric Calciano, lead benefits advisor for New City Insurance.